conference will now be recorded.
Okay. Okay. Excuse me. All right, good evening and welcome to the Access for All Transit Plans public meeting here at the SJTPO, South Jersey Transportation Planning Organization. The Access for All Transit Plan, and actually there's one for each county that we represent, so there's 4 in total. It's one of SJTPO's core documents, and it's a requirement under a federal grant program, Section 5310, which gives money to transit authorities for primarily to serve senior citizens and the disabled. But there's other important applications as well, and which we'll get into very shortly. So I just want to start off with an introduction. My name is David Heller, and I'm a program manager here at the South Jersey Transportation Planning Organization. And how about we go in the room here, and then we can go introduce people who's attending virtually to my left.
Hi, my name is Ben Woodward. I'm an assistant planner here with SJTPO, and I'm just assisting in today's meeting.
Good afternoon, Jennifer, or good evening, I suppose. Jennifer Marandino, Executive Director of SJTPO. And I think we'll start with Andrew, and then you can introduce Claire as our consultant team that helped us with this effort.
Sure. Hi, everybody. Andrew Levecchia with WSP, project manager for staff augmentation with SJTPO, in which WSP assisted the SJTPO in writing these Access for All transit plans. And I'll turn it over to my colleague, Claire Hutchinson.
Hi, everyone. Claire Hutchinson, transportation planner with WSP, and I've been helping the SJTPO with developing these 4 plans.
Okay, we have John Wheeler.
Hi there.
There you go. Since you have unmute, go for it.
I'm from Cape May County, Seaville, New Jersey.
Thank you, John, for joining us. And Susan?
Hi, I'm Susan Sorrow. I am the project director of Cumberland Area Transit Systems, Cumberland County. Glad to be here.
All right, Dave.
Okay, next slide, please. Okay, so we just did introductions. Next slide, please. So here's an agenda. So first, we're going to talk a little bit about what the Access for All Transit Plan is, or what they are. Like I said, 4 plans in total, 1 for each county. Then we're going to go through an engagement summary, just summarize all the extensive engagement that was done as part of this project. That'll be followed by key plan findings. Again, a summary of the main findings of each of the plans, or the key findings of each of the plan. That will be followed by recommendations, or again, a summary of the recommendations. Next is question and answers. And then we'll wrap it up with next steps, what's going to be happening after this public meeting ends. Next slide, please. Okay, so first, Access for All Transit Plans. So as stated on the slide, the Access for All Transit Plans are the coordinated plans for the 4 counties in the SJTPO region. And for those of you who don't know, we cover Atlantic, Cape May, Cumberland, and Salem counties. SJTPO is updating these Access for All Transit Plans on behalf of each of our 4 counties. The Access for All Transit Plans are updated every 5 years, and the previous plan was adopted in 2021. So it makes sense we're adopting these in 2026, 5 years later. Next slide, please. So the Access for All Transit Plans have a number of required elements. They are a federal requirement. First is an inventory of transportation providers. Second, they need to include an assessment of transit needs and mobility gaps, focusing specifically on the experiences of older adults, people with disabilities, and people with low incomes. These are often referred to as the transit dependent or the human services population. They also need to identify duplicative services. Also, they need to include extensive outreach with stakeholders and community members. Also, they need to include recommendations for strategies, activities, and/or projects. Further, they need to include implementation priorities based on resources, time, and feasibility. And finally, there needs to be an assessment of vehicle accessibility and equivalent service. We're going to be describing each of these in the next couple slides. Next slide, please. So, as I said at the outset, these plans are required for various transit authorities and projects to get certain grants under federal programs, and most notably, the FTA Section 5310 program. This is a program which serves, it's called Enhanced Mobility of Seniors and Individuals with Disabilities, but it specifically serves transit services that will improve mobility for seniors and individuals with disabilities. And as stated on the slide, these projects have to be included in a locally developed coordinated plan to have a chance for funding. However, even aside from the Section 5310 program, there's other grant programs that may not require coordinated plans. However, they may prefer applicants that can demonstrate their projects were recommended by coordinated plans. In other words, if their project is in a coordinated plan, they might get extra points. So some of these other potential funding programs include New Jersey Job Access and Reverse Commute Program, the Senior Citizen and Disabled Resident Transportation Assistance Program, and the Congestion Mitigation and Air Quality Program. Some sample projects might be like buses and vans, either new or replacement vehicles, wheelchair lifts, ramps, and securement devices, transit-related technology such as dispatch software, acquisition of transportation services through a contract, travel training, and volunteer driver programs. Next slide, please. So here is a timeline of this project, just summarizes, where we are and where we've been. So you can see it started off a little bit more than a year ago with last January through July. We held a number of stakeholder meetings and did a lot of data analysis. Again, a lot of this was spearheaded by our consulting team, WSP. So, they've done a great job. Kudos to them. This was followed by a public survey conducted online August through September. Then there were a couple of public and stakeholder workshops. And in December, there was a workshop for our technical advisory committee, which kind of summarized a lot of the input from these workshops. And finally, end of December, or right before the holidays, there were draft plans based on stakeholder and community input. And now into this new year, the draft plans were published on the SJTPO website on February 5th. We're now in the middle of a public comment period and stakeholder review. The public comment period started on February 5th and goes through March 8th, Pardon me. We're shooting to have our policy board accept these final plans at our March board meeting, which is the end of March. I can't recall the exact date off the top of my head. It's generally the fourth Monday in the month. And then that'll be followed by the county's lead agencies who will adopt the final plans. Now, I do want to note that the lead agencies are generally considered the transit authorities. Like in Susan Sorrow's case, CATS would be considered a lead agency. However, it would be likely the county commissioners that would actually adopt the final plans. But technically, it's the lead agencies that are supposed to adopt the final plans. We, as the SJTPO Policy Board, are accepting the plans, but I think it's really, these plans are for the counties, so that's why they kind of have the distinction of adopting the plans. Next slide, please. So now I'm just going to summarize the engagement. Next slide, thank you. So this slide summarizes a lot of the very extensive engagement, which, as you saw earlier, is a requirement of this plan. 11 stakeholder meetings, various a whole myriad of stakeholders: New Jersey Transit, all the county transit authorities, South Jersey Transportation Authority, and a number of other ones. These were held from January to October of 2025. This online survey that I mentioned a little earlier, Community Mobility Survey. There was also a separate survey held just for the stakeholders. Again, the people more, or the agencies more intimately involved in transit, like the transit authorities or transit advocacy groups and whatnot. There was a public workshop held on September 30th of 2025, and a stakeholder workshop held October 6th of 2025. On the right side of this slide, you can see a summary of the results. We got 461 responses, which is quite good. A lot of people have been in this business a long time. It's not easy to get a lot of responses on surveys. It's just kind of the nature of the beast, so to speak. But 461 responses, I would say, is quite good. And you can see that there's just a summary of what the comments on the survey reflected. You can see a number of addressed unmet needs, a little bit more addressed suggested transit service improvements, and then quite a few addressed infrastructure issues. And as far as number of responses by county, generally they paralleled or they correlated with the population of each of our counties. The only difference is Cape May County had the least number of responses, and they have more people than Salem County. So there's a slight discrepancy there. But generally it correlated with our population, the number of responses. Next slide, please. So here's again a summary of the engagement findings, sort of categorized by general topic area. You can see on the upper left, service needs and coverage. This just means that, or refers to people wanting extended service hours, as well as more routes that connect to essential destinations. And by essential destinations, I mean schools or educational facilities, food places, nutrition places, and medical facilities, just to name a few. Accessibility, safety, and infrastructure. So a lot of people expressed concerns about improving accessibility to meet Americans with Disabilities Act, which is obvious as this is a human services transportation plan, more pedestrian connections, and more low-cost mobility options. Coordination and information sharing. Again, this is probably pretty obvious as coordinated is in the title of these plans, Coordinated Human Services Transportation Plan. So it's a main theme of this whole effort. So a need for more information sharing amongst transportation providers, as well as improved ways to share information to riders. Service frequency and reliability. Obviously, as with most transit services, riders want increased service frequency, increased safety and comfort, faster travel times, and more weekend and off-peak options. And finally, rural and underserved areas. Obviously, this area that we as the SJTPO serve is predominantly rural, and I think most people know it's underserved. So this should be pretty apparent. Next slide, please. So now I'm just going to go through key plan findings. So again, I'm going to go through each county or each county's plan. So here, just again, some of the key findings. Limited service options in Western Atlantic County, which I think most of you know is more rural than the eastern part, which includes Atlantic City. Limited weekend service options. Lack of first and last mile connections. Being in this business for a while, I hear that quite a lot, first and last mile connections. People lacking access to get onto transit, and at the end of the trip, lacking access to get to their final destination. So that's a very common theme I hear throughout. Existing demand response transportation options often have limited hours, like 8 to 4 p.m., making it difficult for people who use these services to get to work and school. And again, as I think probably most of you know, people especially who work in some of the service industries like casinos and gambling, the gambling industry, oftentimes they have night shifts. So these demand response services are inconvenient for them. Just bottom left of the slide, Atlantic City has high transit needs and mobility gaps. By mobility gap, this is defined as the difference between the number of trips made by people who have access to a car versus those who don't. And you can see Pleasantville, Ventnor, Summers Point, McKee City, Egg Harbor City, and Port Republic have moderate to high mobility gaps. Again, all of this is just kind of a summary. The actual plans themselves have more details and explanation behind each of these points. Next slide, please. So Cape May County, again, as we've seen in some of the other counties, limited and infrequent service in rural areas, especially Woodbine and Upper Township, fewer transportation options in the spring, fall, or winter. And this is due a lot because a lot of the services in Cape May County are seasonal. That is, they generally only run in the summer or the tourist seasons. Like Atlantic County, the existing demand response transportation options have limited hours, making it difficult for people who use these services to get to work and school, et cetera, et cetera. Again, lower left corner of the slide, Wildwood and Ocean City have high transit needs and mobility gaps. North Wildwood, Wildwood Crest, and Lower Township also have high to moderate mobility gaps. Next slide, please. Cumberland County, again, similar to the other two counties we've already gone through, limited and infrequent service in rural areas. Just as an example, commercial, Lawrence, Fairfield, and Hopewell Townships, excuse me, unmet demand for transportation to and from dialysis appointments, and CATS, Cumberland Area Transit System, that Susan directs, has limited hours. And I'm not trying to pick on you, Susan, that's just one of the findings that came out. 8 to 4 p.m. makes it difficult for people to get to work, school, et cetera, et cetera. Again, just to highlight, Millville has high transit needs and mobility gaps. Vineland, Bridgeton, and Commercial Township have moderate to high transit needs and mobility gaps. Next slide, please. Okay, Salem County. So there are no fixed route services in a number of cities in Salem County, Elmer, Pittsgrove, and other western Salem County communities. Like other counties, limited weekend service options, limited service to Delaware and Philadelphia. And Scoot, the main paratransit provider in Salem County, has limited hours, making it difficult for people to get to work and school and other essential destinations. Again, just to highlight a few of the cities, Penns Grove and Salem City have high transit needs and mobility gaps compared to other areas in the county. Carneys Point, Pennsville, Piles Grove, and Woodstown also have moderate mobility gaps. And I also want to point out one thing with Salem County, the eligibility of their paratransit service, Scoot. They do service adults age 60 and over and people with disabilities. Unfortunately, they don't service low-income people, or that's not an automatic qualification. So, you know, that was pointed out as a need. So again, that's just a summary of some of the main points that were identified in each of these plans. Next slide, please. Okay, so now recommendations. So the way these strategies and projects have been framed, there's time frames, near term to be implemented within 1 to 2 years, midterm to be implemented within a span of 3 to 4 years, and long-term 5 or more years. So next slide, please. So each of the strategies and projects fell under one of 6 sort of general groups. So I'm going to go through each of them somewhat briefly, but if you have questions, you can ask after, at the Q&A session. So the first kind of grouping is maintain existing transportation services. This came out a lot in our meetings. And again, you can see the specific projects that fall underneath this kind of overall topic: purchase, lease, replacement vehicles, prioritizing smaller models, fund vehicle preventative maintenance, purchase replacement software and technology, procure contracted services, write grants for transit funding, and identify new transit funding options. And you can see that all of this was labeled as near term, so something that hopefully can be implemented within the next 1 to 2 years. Again, all of these strategies are explained in more detail in the actual plans themselves. So this is just, I'm kind of going through a very high level summary. Next slide, please. Implement capital and technology improvements. That's another grouping, if you will. So upgrade existing vehicles to be ADA or Americans with Disabilities accessible. Embrace technology. Purchase benches and shelters for bus stops. Explore opportunities to implement microtransit and micromobility systems. And for those of you who don't know, microtransit is almost a cross between, regular paratransit service and Uber. It's become kind of a buzzword in the transportation, planning industry. It's demand response for maybe small buses, and a lot of our counties and here and across the country are exploring microtransit. Improving access to bus stops and improving pedestrian and bicycle connections to bus stops, also pointed out by many of our counties. Again, you can see it's a lot of them are near term, but a few of these strategies are midterm, and then of course, long term. Next slide, please. So a third grouping: improving outreach and communications, increase online marketing, improving digital information resources, developing new physical outreach materials, increase coordination with human services agencies. So not just transit agencies we should coordinate with, but human services agencies like the United Way might be a good example. That was an interesting finding. And increase travel training programs. Next slide, please. Fourth grouping: expand and improve transportation services. So shorten required reservation windows, partner on transit-related studies, conduct studies on potential service expansions. That's in the actual plans, you'll see there's partners on who could implement these projects, and point out like the MPO, we could be a partner on a lot of these projects or some of these projects, or the transit authorities, but that's explained in the actual plans. Conduct studies on, I just said that, conduct studies on potential service expansions, extend weekday service hours, which we saw earlier, expand service eligibility for demand response services. Again, some of these agencies, may only serve us, limited, may only serve human services, the human service population, but in some cases, serving the more general population might be even more beneficial. Purchase or lease expansion vehicles, another possible project. Increase service to out-of-county destinations. That was a big thing we found out in our outreach. A lot of these county paratransit services can't really, by law or regulations, can't really transport people out of the county, or at least at a very short distance to go out of the county. Increased weekend service options, add fixed route service options, procure contracted services for new programs, and continue to expand staff resources based on service levels. Just as a side note, again, we saw, with all of our counties, especially hiring drivers, that's a constant problem. Just lack of, probably a number of reasons, but there was a severe driver shortage for, I think every transit agency was experiencing that, but it could also administrative staff was cited as a shortage as well. Next slide, please. Improve agency coordination. So again, meeting with regional partners, as we did a lot earlier in this project. Establishing a 4-county coordinating committee. I think each of the counties have their own coordinating committee dealing with human services transportation, but a lot of people expressed a more region-wide county coordinating committee, which we've already started investigating. Establish or explore the potential for establishing a regional mobility manager position, kind of oversee the overall operations of the county, 4-county coordinating committee, or have a regional mobility manager, maybe have one per county. Explore cost savings opportunities and providing services and whatnot. Explore the potential for sharing vehicles and analyze options for centralized maintenance. So next slide, please. And the last one, the last grouping, like I said, is adopting policies to facilitate transit use, adopt zoning policies conducive to transit use and designation as a transit village. I'm not sure how many of you know, but right now we have 2 transit villages in our region, Atlantic City and Pleasantville. It might be worth for maybe a couple other municipalities such as Vineland to investigate whether they can become a transit village. Allows you to get maybe priority access to certain state grants and whatnot. And then adopt complete streets policies. That could also help in facilitating transit use. Next slide, please. So that concludes my talking points. Thank you for your attention. And now I'd like to open it up to questions.
Just and remind you, if you wanted to ask a question, you can go ahead and unmute yourself. Susan, I assume you just give us a thumbs up and not was raising your hand.
I didn't see the raised hand. I did the thumbs up.
Okay, well, that'll work too. Go ahead.
Okay, the one slide about you had Cape May and Cumberland not applicable about services going back. Okay, that one there. Okay, going back here to expand service eligibility for demand response services. What were you referring to? Because we do service the general public.
Oh, well, I can try that. And Claire, we were just talking about this a little bit earlier today. Claire or Andrew, you can chime in, but I think we specifically put NA because you, Cumberland County, you don't really need to expand service eligibility because you service the general public as well as. So it's kind of it looks like it's a negative, but it's really more of a positive.
It's a positive. That part, yes, this part didn't need to be. Okay. Yeah. And we also take people to Philadelphia and Wilmington and Camden. We do go outside the area. And you're probably aware of that from my.
David, do you mind if I add a point here?
Yes, please.
Absolutely. Absolutely.
Yeah. David mentioned, yes, Susan, we put that as not available because you all already do serve the general public, while Atlantic and Salem's primary demand response services do not at this time. So that's why it applies to them, not to you.
Right.
The plan absolutely mentions that you go out of county. So don't worry about that. It does say that CAT serves out of county trips. The bigger stress is just that from what we heard during engagement, nobody has enough capacity to serve those trips as frequently as people need to go. So it's more so just increasing service, but it does acknowledge that you all already do it.
Yeah, we do. I would love to be able to get more drivers and, expand
Vehicles and
hours.
do it, but like,
Yeah.
it's just hard.
But yeah, thank you very much for addressing that. Appreciate it.
Thank you for the question.
I think it's also a funny feature of GoToWebinar that there is no raise hand. We just get to do thumbs ups. That is a nice feature.
I think there is an actual raise hand. You just have to go under react and then raise hand, but it does give you the quick reactions first. So
I've
Susan, I
learned-
appreciate that
I've
you gave us
learned.
the thumbs up and not the thumbs down, because that is also another option. Andrew. Not nice. Andrew's giving us a thumb
See
up.
my
and a
hands
thumb
up. No, I did the thumbs up, thumbs down, my hands up,
down. Now your hands up.
smiling face.
Just testing it all out. John, I assume that you're a member of the public. Did you have any questions or concerns that you would like to bring up about this evening?
In Cape May County, I think it's called the Fare Free Transportation thing, which I believe is run by the county. Are there any others that are included in this plan?
In Cape May County.
I mean, they're definitely the main ones. Other than, I think, New Jersey Transit, which of course isn't exclusive to Cape May County. Are you talking about like transit providers?
Yes.
Any, yeah, I don't think there's any others. Claire or Andrew, I don't remember off the top of my head though.
John, the plan does include, as David mentioned at the beginning, it includes a full an inventory of all the transportation providers that we know that are operating in the county, including public, nonprofit, and social service agencies, as well as private. Cape May, the only public transportation providers are NJ Transit and Cape May Fare Free Transportation. But there are a few social service agencies that provide transportation services. And then there is also in some of the beach towns, the Jitney.
Yeah, yes, that is correct.
Yeah, and the jitneys are only in the summer, I believe. And I think that's the same ones that run the jitneys in Atlantic County or Atlantic City.
Yes. So they operate in both. And yes, the difference between the Atlantic City service and the services in Cape May is that the Atlantic City service is year round. But the Cape May service is definitely, the Cape May County services are far more limited in their days, hours, and months. And I will say that, yes, like another public transportation provider that operates in some counties, but admittedly not Cape May, Cumberland and Atlantic, the South Jersey Transportation Authority does operate some shuttles there, but that is the only other big public transportation provider in the region besides your 4 specific county demand responses and NJ Transit. Oh, John, but that was also the one other point I did want to mention to address your question was these recommendations, multiple transportation providers can try to implement these recommendations. So the recommendations are not necessarily specific to just Cape May Fare Free. Nonprofit organizations can implement these recommendations. New agencies could implement them. So they are not, many agencies could pursue these recommendations. It's just that the primary human services providers at this time are Cape May Fare Free, CATS, Scoot, and Atlantic County.
Thank you.
And John, if you didn't already take a look at the chat, I did drop in SJTPO's Access for All Transit Plan website, as well as links to the individual county plans that are posted on there as well.
I'm on a tablet. I don't see the,
Okay, well, then I recommend that when you get to a computer, you take a look at sjtpo.org and then.
oh, there
you
it
can-
is. I found
Okay.
it. It's up
Okay,
the
great.
top rather than the bottom.
It's technology is wonderful most times.
Right, yeah. Where'd they hide it on this one?
Well, Dave, if you don't have any other questions that are of anyone about the plans, I think you can finish out with talking about the comment period and how people might be able to make comments generally.
Okay, there is actually one more slide.
Okay.
Okay, so again, like I said earlier in the slide, we are in the middle of the public comment period. It goes through March 8th, so there's still, I guess, a couple weeks left. And you can comment online, go to our website. There's a direct email address, www.sjtpo.org is our website. And you'll see that, there should be, I believe it's on the homepage, Access for All Transit Plans, and there's a specialized email that you can submit your comments. Actually, we're going to show it at the end of this presentation as well. Okay, I'm sorry. And then, as I said earlier, we are shooting to have our policy board accept these plans, all four of these, kind of short of adoption, but accept these plans at our March board meeting, and which is the fourth Monday in March. And then that will be followed by the county's lead agencies, mostly the transit authorities, for each county adopting the updated Access for All Transit plans. And I should say, after the comment period, we will be issuing hopefully like a final set of plans to address any of the comments during the public comment period. So any, whatever comments we receive, there'll be at least one more iteration of plans. I mean, hopefully not any more than that, but one more iteration of plans that will be released, and then, they'll be final. And so, any other questions related to providing comments or anything, or feedback?
No hands raised.
Okay. Okay, so there's one more slide. Yeah, like I said, and I should say, there's also our phone number listed on the slide, so please feel free, if you don't want to use email, if you have a verbal comment, you are free to call our office, and they can ask for myself, and certainly give your comment verbally as well. So that's all I had. Again, thank you for your time and interest. I really appreciate it. And then have a good evening.
Good evening. Thank you.
Thanks, everybody.